Hi everyone, my name is Taguicana. I did my senior preceptorship at Good Samaritan Hospital in the Progressive Care Unit.
And my name is Kayla Kashima, and I did my preceptorship at Allenmore Hospital in the intensive care unit. The title of our capstone poster is Critical Nursing Care of the Adult Patient Experiencing Sepsis. So just to start off, a quick definition of sepsis that's included in our poster is that sepsis is a life-threatening clinical syndrome involving organ dysfunction caused by a dysregulated response of an individual's immune system to infection. So what really sparked our interest in doing sepsis was that both Devon and I have seen numerous cases of sepsis and observed several sepsis codes during our time at both the ICU and PCU. So through these experiences, we realized that sepsis is a very common clinical condition seen in various settings, both inside and outside of the hospital.
We also realized that since sepsis is a systemic condition that can be very preventable with early and effective interventions, we were really interested in exploring the most recent evidence-based practice to prevent and treat sepsis as well as its life-threatening complications.
Through both the literature that we researched and our clinical experiences in our preceptorships, we discovered how crucial it is to perform comprehensive assessments on patients with infection to be able to intervene as early as possible and further prevent the progression of sepsis. One important intervention that we noticed in practice was the utilization of the sepsis bundle that is implemented within the first hour of recognizing sepsis.
Another thing that surprised us was that in our practice, we discovered that after the timely recognition and management of sepsis, specific interventions are implemented based on the source of infection as well as the specific pathogen that was identified. Therefore, we realized the importance of further individualizing care for each patient who has sepsis or is at risk for sepsis. Some key takeaway points that we would like the readers to know is that one is according to the Sepsis Alliance, sepsis is the number one leading cause of deaths in the hospitals and as well as hospital readmissions. Sepsis can easily progress to multiple organ dysfunction syndrome, which will ultimately lead to death. And another takeaway is that, as I mentioned earlier, sepsis is very preventable, and performing a comprehensive assessment early on will assist in preventing and treating sepsis. On our poster, one of our patient outcomes is for the patient to be free of life-threatening complications such as disseminated intravascular coagulation, acute respiratory distress syndrome, acute renal failure, and septic shock. As nurses, we play an important role in achieving the goal of not only preventing sepsis, but also preventing the progression to the life-threatening complications that are associated with sepsis.
Another crucial point that we want readers to take away from our capstone poster is that it's really important to perform frequent pain assessments. This is because, based on the TIME acronym by the Sepsis Alliance, the E stands for extremely ill, in which one of the main symptoms of sepsis includes the patient experiencing severe pain and discomfort. Moreover, sepsis is a systemic syndrome that affects the entire body. Therefore, it's really important to monitor the patient's pain and provide the necessary interventions in a timely manner to help with the patient's comfort. So, some of the acknowledgements that we want to make is that we want to thank our preceptors, Tiffany Thompson, Elliot Edwardson, and Kristen Arnold. We want to thank our supervising professor, Dr. Dana Zeichkin, our clinical instructors, Dr. Megan Morrison and Rainey Bannock-Wood, and the rest of the staff at Allenmore Hospital and Good Samaritan Hospital. And then finally, we want to thank our family for always supporting us throughout our journey in the nursing program.
Yes, thank you for listening to our capstone project presentation.